Okay, it is 9:30. I may have to stop from time to time to admit people in. This is a new format that we are using. We are starting to use Zoom for our meetings so we can have just a little bit more control over our meetings. So everyone should be entering in on mute. If you are not on mute, we ask that you please mute yourself just so we can reduce the background noise. So that everybody can hear. This is our second Transportation Advisory Committee meeting of the year. We hold these meetings quarterly. Due to COVID, we've only had one other meeting, and I know that other mobility managers have been struggling to hold their meetings, but with the use of technology, we are able to do that. We are also want to let you know that we are recording this meeting so that others who were not able to attend today, and also just for yourself, if you want to review this information again, it will be made available to you. So wanted to let you know that too. We are scheduled from 9:30 to 11:30 this morning, but we are also hoping maybe that we can get out of here a little bit earlier than that, because I know everybody is busy and you have a lot of other things to do, and you're probably on a lot of Zoom meetings these days. So we want to try to make your time as effective and as efficient as possible. So what we would like to first start off with is to really kind of get you engaged this morning. And so what we're going to do, we're going to play this. It's kind of a game a little bit, and it's a fun game. And I've learned this from the Lorain County Public Health Department using a program called Menti. So what you can do is exit your screen or use a cell phone to participate. It's Menti, MENTI.com, and you can see the code right there to use once you get to menti.com on your phone. So I'll pause so that you can do that. And then you want to keep your screen just a little bit open, because what you're going to see is the results here coming up on the screen. So the code to enter is 8529877. I'll just give you a little bit of time to get to that. All right. And the code will remain at the top if you, it's at the top. Oh, you know what? I have to share my screen. I'm sorry.
Sharon, I'm sorry, what was that code again?
And I believe I am sharing it now, and it is at the top, 8529877. Okay. Let me try to advance this now. Okay, the first question. What are you drinking this morning? I'm going to start off with an easy question. Ease your way into this. Water, coffee, a lot of coffee this morning. Tea. Something else. All these answers are anonymous too, so I don't even know who's answering it. So you can be honest if it's something else. All right. So we'll move on to the next question, which we want to find out who's in the room today. So what type of organization do you represent? Or are you representing today? So we have social service in the room. Governments. All right. Other. Great. Great. So we have a lot of social services and we have government. Let's go on to the next question. So, do you consider transportation a barrier for your clients? A major barrier? Okay. All right. I mean, that's what we kind of anticipate, but we don't want to assume. So next question. When you think about transportation in Lorain County, what comes to mind? You can make it one word, 3 words, a sentence. And you have 3, you can put in 3 different words, 3 different sentences. Difficult. Specific needs, scarce, poor, difficult. Rural, not accessible. Needs improvement, difficult. When the words get larger, that means that a lot of people are saying the same kind of thing. Limited, expensive, none, scarce, underserved, time consuming. In Wellington, non-existent, specific need, not accessible to clients. Underserved, unconnected. Good one. All right. All right. Well, I want to let you know that through collaboration, we can really make a difference, and that's what the mobility management program is all about. So I don't want us focusing on these things, but look at these as opportunities for what we can do here in Lorain County. And, you know, I want to once again say publicly that I appreciate the support from the county commissioners in looking to work with us on resolving these issues. So hang in there. We are working to try to make a difference. So next question. Or is that my last question? Oh no. Why do your clients primarily need transportation? What are their destinations that they are going to? And you can pick more than one. This just really helps me with understanding areas that we need to focus on. Right now we have equal, okay. Okay. All right. So we're really seeing medical is starting, medical and grocery store bank seem to be really a need right now, followed by medical outside Lorain County, and then work. And then also that's followed by going to school or going to college. So this is what we thought, but it's really good being able to hear from all of you. And I think we have one more question. This is our last question. What concerns do you have about transportation during this pandemic? And this is another one of those word clouds. Is it like cleanliness? Is it about using public transportation? Is it about, you know, what are your concerns? Is it that you don't have enough information? Okay. All right, so we have safety is the number one. Cost, sanitize, availability, medical access, transportation availability, risk minimization. So safety and distancing and reliability and capacity. Okay. Access for elderly. Amount of drivers, yeah. Ease of use. Okay. So we see capacity, safety, and distancing are the top concerns. So thank you for allowing me to engage you. I thought that that was a really cool kind of tool that I learned about recently, and wanted to use that as a way to be able to get our meeting started. So I wanted to go over what the agenda is going to be today. I'm going to give you a couple of mobility management updates to let you know what we are doing currently. We are going to talk about the community survey that we need to do on an annual basis. Want you to review that information with me to see if you have any concerns, because we're hoping to get that out this fall. We're going to briefly review with the 211 system. It's new and improved, and there are some changes to it that we want you to be aware of. Then our main presentation today is going to be from Life Care Ambulance, and Joe is going to present that. And then we are, if you have any general announcements that you want to make, we would love for you to be able to make those at the end of this meeting. So briefly, what I want to do is remind you about the mobility management program and how we came here today to have this program. It started with Move Lorain County. Move stands for Mobility and Opportunity for a Vibrant Economy. Having a desire to improve transportation options throughout Lorain County. And they came across an opportunity through ODOT to create a mobility management program. And with that, we had to put together a coordinated transportation plan in which we surveyed and received over 700 surveys from residents across Lorain County. And as a result of those surveys and other information in community meetings or quarterly meetings like we're having today, we came up with these 5 goals or objectives that we're looking to accomplish by 2022. Now, I want to, as a side note, want to let you know that every 5 years we have to update this plan, and so it's due for an update in 2022. So we have to do a complete review and update of the plan. But until then, we have to do, we do surveys every year. But these are the 5 goals or objectives that we are planning to achieve. Is developing and implementing a mobility management program, which has been done with a partnership with United Way of Greater Lorain County. Increase awareness of transportation options. This one's very important because with the survey, we found that half of the people who responded did not even know what transportation options exist in Lorain County. Explore data collection and planning synergies. And the data collection has to do with surveying the community to understand what the needs are so we can begin to increase capacity and close those gaps. Also look at planning synergies, which means not just constantly throwing money at situations, but how can we all work together to solve these issues that we're having in Lorain County. And then coordinating educational training programs. I've gone through training programs. There might be other opportunities where we can come together to do training programs. That is another objective. And then one of the objectives that excites me the most are pilot projects, which we've had 2 of. We have Circulation Health, where we've been working with the Nord Center using a software platform and Lyft services to transport people to appointments, but also as a result of COVID, we have been working with Licata using their vehicles to transport seniors from a facility or from the apartment complex to local stores, so that during senior hours, using social distancing and encouraging people to mask, but they're able to get out, and that program has been going very, very well. So we're very excited about that, and it really helps us see what we can do when we work together here in Lorain County. So next, I want to kind of tell you about some of the things that we have been working on for the last couple of months. It's been a little bit of a challenge, as I know I was telling Kenneth from Lorain County Community College due to COVID, but we've had to be creative in what we are doing. So one of the aspects that I have been working on is we have put a transportation provider list on the Move Lorain County website, and we also have a new blog that is there too. So let me share that website with you so you can see where it is. 1 minute while I share my screen. So this is the Move Lorain County website. And right here where it says transportation options, takes a little bit of time. But so this is where you can see these options. I want to mention that what we like to do is always encourage people to use 211 as the primary place where they want to go for resources. They can get information quickly and easily that way by doing that. And then there's a little video that we're going to review shortly and explain some of the changes with the 211 system so that people can understand. But underneath that, what we've done is listed the transportation sources that we know about that are mainly nonprofit organizations, government agencies, or social service organizations in Lorain County. And on this list, we've stated what their service status is, which is something we probably wouldn't have done if COVID wasn't around, but we're doing that so people know. So the way that this is listed is it's listed first, who has limited operations, normal operations, and then the down below, who's temporarily closed right now. Now, if you want to see more information on each of these services, what you would do is click on more information. And that opens it up to another page that gives more detail where they can call, who is eligible to use those services, what type of payment, operations, and then people can click on the website to do a deeper dive and go straight to the website for more information. And then right here is just a basic description of those services. So this is what we've added. We are also looking to add for-profit and other transportation services to this website because those for-profit for the most part are not going to be listed on 211. And Christine, can you tell me, we've added the Move website to 211? Okay. So the Move website will also be added to 211 so that people can use that as a resource for other services, for-profit services that eventually will be made available on this website too. Also want to just point out that we had a volunteer who wants to write articles, and she has been working with her kids on bicycling, and so we are going to start having article series regarding transportation throughout Lorain County. Just wanted to want you to know about this as well, and to encourage you to take the time to read that. So I want to know if there's any questions or any comments that anybody had regarding the website or what we are doing here with it. Okay. I'm going to go back to sharing my screen so we can continue. So, ODOT is really encouraging mobility managers to promote ourselves by going out, by using different marketing tools to promote ourselves. And so what we have is this new touch tool. I'm sure some of you have seen it on TV. I've even given some of you this. It really helps you from personally touching high touch areas that other people are touching. It helps you keep a distance. And so we're going to be giving these out. We're working right now with Neighborhood Alliance and Office on Aging to give this out to the at-risk and senior populations. So you'll be seeing these out and about, and they're really nice and handy because you can put them right on your keys. You can see the picture over to your left and the different ways in which this can be used. So wanted to let you know about that. Also, I am working on an employer transportation toolkit because we realize that many employers don't even realize many of the resources that are available out there for people to use so that they can get employees to work. And we also want to do this in connection with the Paradox Prize Let's Get to Work Lorain County project that the city of Oberlin is heading up. That project that you did hear about at the last TAC meeting, I believe that they've pushed the start date back temporarily right now to January, not temporarily, but it's been pushed to January right now. But I'm hoping to get this employer toolkit in the hands of employers prior to the start of that so they can have that and hopefully, really help the success of that pilot project. Speaking of training, I have recently completed my introduction to travel training. And why that's important is because there have been instances in many reports in which people have said that sometimes people don't ride or use some of these services because they don't fully understand how to use them. I know that in February when I rode the buses, it was a little bit intimidating because I did not fully understand what it was going to be like to get on that bus. And so that's what a travel trainer does, is help people learn how to use the bus, get them comfortable, map out a way to get to medical appointments or get to work or do some of these other things. And it doesn't just have to be the bus. It could be walking, it could be biking, it could be using Lyft or Uber. So those are all the different types of services that I am going to be developing a plan that I can put in place for how to use that, how to do that, how to offer that service to your clients or to people who may need to understand how to use those transportation options. I've come across a couple of mobility managers that are actually doing it virtually. There's even a gentleman over in Lake County that is doing social distancing travel training and virtual travel training. So I'm hoping to talk with all of them to develop that program, and we'll get that information out to you when it's ready. We've also started a monthly newsletter. We have two different audiences. We have one that's nonprofit, business, and transportation providers. Then there's another one for transportation users, and that came about as a result of the surveys that we did in 2018. We asked for people to list their email addresses as an option, and we had about 90 people on those surveys that said they wanted more information about transportation. So I now have a special transportation newsletter that goes out to alert them about transportation options. And so that's going to be going out monthly too. So if you have people who are interested and you know that they want to know more about what's going on in Lorain County regarding transportation, you can send them my way. Eventually, I'm also going to be adding a button on the Facebook page, the Lorain County Mobility Management Facebook page, where people can sign up to subscribe to that newsletter as well. And then want to also let you know that we are very, very happy to report that United Way of Greater Lorain County has received the second round of Ohio Department of Transportation funding to continue the Lorain County Mobility Management Program for 2021. This is a grant process we have to go through every year. United Way has received $80,000, but there is a 20% match that we are seeking to help us pull down that $80,000. So people can make donations there. I believe it's United Way website / mobility management to make a donation. So if you or somebody you know is interested in helping to make sure that this program continues, take a look at that. So before we move on to the 211 updates, want to see if there's any questions that anybody had right now on anything we just mentioned.
Hey Sharon, this is Kenneth Glenn, Lorain
Yes.
Community College. I just wanted to make sure it was okay for us to share this information on our community outreach e-newsletter.
Oh, yes.
Specifically the 211 website.
Oh, yes, definitely. Yes,
Cool.
that's the goal right now, is we're really trying to push out the 211 information as much as possible. So yes, share all of that, share about our newsletter. That's what I'm here for, is to make those connections with people, because we're finding so many people have no idea what even exists. And there's more transportation out there than I even knew before I got into this position. And I've been working on transportation for 12 years. So yes, please share it.
Thank you very much.
Anybody else? Oh
Sharon,
yeah, Rick, do you have any other questions?
Sharon, are the city mayors and that, do they know about the 20% match? Can the cities contribute to that 20% match?
Yes, they can.
Okay.
They can. Do they know about it? We did have a press release that came out last week or the week before, and we did mention this. So, you know, I'm not sure, but if anybody's willing to help promote that, that would be great.
Okay.
Any other questions? If not, we will go ahead and move on to, if I can advance my screen. I'm having a hard time advancing my screen. Oh, you know what? Okay. So I think Christine will present on this.
Good morning, everyone. Sharon's going to play for you in just a moment a little canned video that we created that shows you how to search the searchable 211 database. But before we get to that, just a quick reminder what 211 is. Thanks for that earlier question about promoting 211. 211 is our county's 24/7 information and referral hotline. It includes, as Sharon alluded to earlier, nonprofits and for-profit organizations for which there is no equivalent service, or a for-profit that provides something that no nonprofit does. There's over 800 listings in our county's 211 database. However, there's over 1,600 services, and 211 is nationwide. Most states in the United States have 100% coverage of their entire state in the 211 system. So when a caller calls 211, it's just simply 211 on your cell phone. And by the way, the calls are routed through the cell towers just like 911. So it'll route to your closest 211 if you're on the road. When the caller calls 211, when the phone is answered, you'll be asked if you want to go in English or in Spanish. If it's Spanish, press 7. That directs you immediately to a Spanish-speaking operator that will talk with you in Spanish. If you choose English, when that call is answered, they'll ask you a couple of pieces of demographic information, and then you're off and running with your questions. Most calls take at least 7 minutes because the caller typically doesn't realize that pieces of their question have other types of answers too. So a caller will call for one specific thing, but as they're talking to the INR specialist, they'll realize that there's additional resources for a different piece of the question they called about. We also have the searchable database. Again, we're going to look at that in just a second. That's the thing that changed recently. Just prior to COVID, we were working on an update to the 211 searchable database, and we rushed putting that out when the communities had to shut down mid-March. So there are specific COVID-related resources that are highlighted on the 211 website, but it's changed enough that we thought we had better create this little quick tutorial. In a future meeting of this group, we'll talk about the data dashboard that we have available also through the 211 website that allows anybody in the community to pull down and run reports on what are the most common calls or what are the most common unmet need calls, so that if you're an organization serving a certain population, you can see what that population is calling about. Or if you serve a certain neighborhood, you can see what that neighborhood is calling about. And that may help you work with your consumers, your constituents, on the services and programs that they need the most. And you can always call us directly, call me directly at United Way. Go ahead, Sharon, thanks. Lorain County's 211 First Call for Help has an online searchable database that can be searched 9 different ways. You can immediately translate this page into languages of your choice. The web page begins with your zip code. The most effective way to begin searching is by adding the zip code first. And I'll show you this first section here. These are the main 3 most often requested services. So I'm interested in what utility assistance is available in Oberlin, Ohio, so I'm going to click on utilities. So here I see the main page where I can select the type of utility assistance I'm seeking. In this case, I'd like to find assistance with my gas bill. There are 11 matching service providers, so I'm going to scroll down, and in this case, I know that I am looking for Oberlin Community Services. I'm going to click View More Information, which will take me to their main page about all of the services that they provide. It gives me an email address and again a web link, intake procedures, fees, eligibility, and so on. Also provides an exhaustive list of other programs that this organization provides. If we jump back onto the page, I want to show you parent agency and email text. Let's first look at this. This allows you to have information about that organization sent to a cell phone, emailed to an email of your choice, and so on. If you jump to parent agency, you get the main landing page for Oberlin Community Services, which allows you that map function. So again, you can get directions using the Google Map tool. You can print the page, email the link, and you can actually click on your organization of choice and get directions that way. I'd like to see what services are available for folks in different communities. Let's look at Avon. I'm going to look at this next way to search. These here are service categories. I'd like to see some things about legal concerns in Avon. In this case, I'd like to search for legal documents. I'd like to find out where in Avon can I find my birth certificate. So I'm clicking there, and again, clicking on birth certificates. So here I see that Lorain County Public Health is my top search. Our county's listings include about 800 distinct organizations and a large variety of national and statewide services, hotlines, and so forth. As you can see, 211 is important for more than just traditional basic needs. You can get connected to transportation, legal services, educational resources, and so much more. I encourage you to check it out yourself to see what help may exist for people in your life.
All right. So thank you, Christine.
Any questions about that? Any questions about the searchable database? You can certainly call us directly here at United Way or call me directly for more information.
And so thank you, Christine. This is the video that is also listed on the Move Lorain County website so that people will know how to use it if they haven't used it before.
Lorain County.
Okay, now we are at the point where we're going to ask you to take a look. I'm going to share the document, the draft survey that we are looking to do. But before I do that, I wanted to just mention that last time we did the survey, it was a 2-page survey. We are now looking to gather more information so we can understand where people are coming from and where they are going to help us better plan transportation in Lorain County. So it's gone from 2 pages to 4 pages. And we're also looking to distribute this with hopefully all of your assistance. September 15th through October 31st is our goal. And then we're planning another TAC meeting on November 12th, where we'd like for all of us to get back together to review the findings from the survey. So just bear with me as I go to my computer and pull up the information. Okay, let me share that now. Okay, so this is the document. We know because it is 4 pages that when somebody first looks at that, they would be overwhelmed. So one of the ways to help reduce that for a person from being overwhelmed is I put at the very top highlighted, this should only take you about 15 minutes to complete the survey. That might be even a little long, but I wanted to at least give people a time frame, so hopefully that they would be willing to complete the survey. Most of the questions are really just, you just check here and move on to the next one. There's a few where we're looking for some more in-depth, but I want to take this page by page for your review. Hopefully some of you reviewed it prior to the meeting, and I will stop briefly after each page just to see if you have any questions. So on this first page, what we have is we are looking for a person's age, their zip code, whether they speak English or Spanish, their employment status, and one of the changes we did make is, are they working in Lorain County or outside of Lorain County? Last time it was kind of difficult to tell because there were some people that with zip codes that were outside of Lorain County, and I knew where the surveys came from, so I could tell that they were working in Lorain County, but they lived outside of Lorain County. So we made a slight change to the employment information. We're asking about disability and what assistance they require. if they are considered low income, places they need to go. One of the changes on here is we did add religious services because that is a place that we're finding that many people want to go to that they may no longer have access to. We're also asking if they're currently able to drive. And if they do drive, where do they drive to? And that's page 1. And I want to also clarify another reason this went from 2 pages to 4 pages is because some other mobility managers have a separate survey for different audiences. I found that kind of overwhelming for me to tabulate all that information. So I've decided to try to put those questions specifically for seniors and for people with disabilities into one document. And I think it gives us overall better information from everybody, because I think those questions we want to ask of seniors or people with disabilities are really the same questions we want to ask of everyone. Especially the questions about whether or not they're driving, because there is a high percentage of people right here in Lorain that that don't even have a car. So we found that to be very interesting. And we want to know more information about that. So I do see that there's a question about if the survey will be available electronically. Yes. We are going to also offer this electronically, but we did get quite a number before that were paper, so we're going to be offering this survey both ways, both paper format and electronically as well. So thank you for that question. And feel free to go ahead and type your questions in the chat box so that I can answer those questions as they come up. I just want to stop and see if there's any other comments or questions you have about this first page before we move on to the other 2. Seeing none, I will go ahead and move on to page 2. So the next page really is starting to do a deeper dive into their transportation needs, especially over the past 3 months. Now, mind you, the past 3 months are probably much different than what they were last year, but I still think that this is a good gauge for us to be asking these questions. So we're going to be looking at what situations do people not want to drive, and during the past 3 months, where were they unable to get to because they didn't have access to transportation. Another question is, what prevents them from taking trips outside of their home? The next question is, how much do they have to rely on others for transportation? And then which of the following statements are true about transportation, just so that we can understand how to possibly market the options that may be available to them. So you can take a look at that there and let me know if there's any comments or questions you have about this second page. Oops, and maybe I am not. Am I sharing my screen? I am, okay. All right. Okay. So we'll go on to the third page. The third page is who do you depend on for transportation, and checking off one of those. This says door-to-door bus or van service. I really need to change that because most people, most services are curb to curb. So that is one change I'm going to make to this document. But if they do have a van service available in their community, or maybe I'll just change it to van service, indicate which of the statements are true, because there are these services, especially for seniors, especially if most of you don't know, for seniors and people with disabilities in North Ridgeville, Avon Lake, Amherst, and I know the Lorain Senior Center, and then Oberlin has a 2-day-a-week, and Wellington. So there's there are these services, but I will say that about half of those are temporarily closed at this moment. I know Avon Lake are still operating, and I can't remember Avon or Avon Lake. I think it's Avon Lake has a community 5-day-a-week service that's free. Avon is just seniors. So that's part of the reason why we're asking those questions. And then we're going to ask about taxi or private transportation services available, if any of those statements are true. And then how do they get to destinations that they need to get to? And then a question about the future. In 1 to 3 years, what destinations do you anticipate needing transportation that you feel you may not be able to get to? And then last is the first question that really is where we want some more information. Where are places that you want to go in Lorain County? So that is the third page. And just want to stop to see if there's any questions or comments you have about what we're asking here. Okay, so now we're going to move on to the last page. And the last page has a couple of more in-depth questions, and then the rest are kind of yes and no. How often do you need a ride from somebody else? And what we're looking for is how many times a week, how many times a month are they seeking those transportation options? Are they aware of the services available? And this really helps us to understand how much more work we need to do to promote transportation throughout Lorain County. How is it they would prefer to receive transportation information? Do they use public transportation within Lorain County? And I want to emphasize that this is not specifically about transit. We are not trying to focus our attention on transit or anything like that. Public transportation, it can be Lyft, Uber, it can be biking, walking, it can be all different modes. I do believe that most people will think about transit when they hear public transportation, but we're really talking about all modes. And if they're interested in using transportation, or if they're interested in public transportation, even if they don't use it. And then what type of public transportation do they use? And maybe I'll switch those questions around a little bit, because I think if we put what type of transportation would you use before we ask if they use any of them, or maybe we can eliminate one of those two. Would love to hear from you just to make it more clear. And then the last two are just general questions. What improvements need to be made to current transportation services? And then if you do not use transportation, Lorain County Transportation Services, why? And then we do once again ask for them to list their email address so that we can promote to them using the monthly e-newsletter. And then lastly, I want to emphasize to them and all of you to please like the Lorain County Mobility Management Facebook page. I post there, I try to post every day there with information that is timely that you can share with others, and you can share that information with your constituents, clients. So just want to stop and see what you think. This is the last page, and if you have any overall comments about this survey that we have drafted.
Sharon, Barbara.
Yes.
At very top question, it's like how many times a week or month. I think you don't need as many lines as you need a dash with a week or a dash a month, so it's clarity what they're responding. And the other comment I had was at the beginning of the survey, I'm sure you're going to have some sort of introduction, but emphasizing if they have responded to any of the other surveys, how much you have gained from the information contained, so that they realize they haven't gone unheard in the previous, and they have been valuable. Because I think when people continue to see surveys, they wonder if it's done any good. So just tell them how valuable they were and how it's gotten us to this point.
Okay, thank you.
Sharon,
Yes.
I am somebody that has a hard time understanding things. Like I couldn't find the chat, so that's why I had to wait and unmute.
No problem.
when I went through the survey before the meeting, I found it difficult to answer because I'm a very literal person. And when you're saying you're cognizant of the fact that the last 3 months have been during lockdown, it makes it difficult for me to answer the questions about whether I would use the transportation or where I would go, because I don't intend to go anywhere, you know, right now. These are not normal times.
Okay. Yeah. So do
But,
you suggest that we remove those questions? Because we can do that.
no, I think they are excellent questions because they're the ones you need answering to be answered. But how about when it's not under COVID circumstances?
Okay.
If it was safe, where would you
Okay.
be wanting to go and what method would you use?
Okay.
Does that make sense?
Yes. Yes. Because when I was reading through that, I will tell you that I stumbled over it going, you know, this may be a difficult question. And I think our answers this year versus 2 years from now are going to be completely different.
Right.
And so I really appreciate that insight.
Good. Thank you.
Thank you. Anybody else?
Sharon, another comment, and just realizing if people do this, you may get a lot of feedback. Just doing this as a pilot with, I don't know, a group of 10 or 15 people, your closest friends, people who are out there, you may get, you know, other feedback that's critical before we launch this much wider. It just makes sense. That's just one person's view was excellent because I think in this pandemic time, it could lead to, oh, I'm not going to fill that out. I'm not going anywhere. I can't go anywhere. Just the thought. Make it valuable.
Yes. Yes. Thank you. Thank you. Okay. Well, we will adjust those.
Sharon, one other quick thing. If you send this out electronically, and I tried to complete it earlier this week, I think it needs to be in like a template. And maybe, I know this is a draft, but if it's in a template, that way the lines don't move around and what have you. And it's just a click when you click on the X or whatever. Just a recommendation if you send it out electronically.
Yeah, so if it goes out electronically, it will be in a SurveyMonkey most likely.
Great.
The paper we will give, like we received a lot of paperback from Neighborhood Alliance. Was one of our,
Okay.
and because when they home delivered meals, they were
Yes,
also delivering these, and so people were using the paper.
that makes sense.
So yeah, so that's how
Okay.
we're going to be doing that.
Great, because that SurveyMonkey will give you the data. You can then download it to Excel or whatever. Yep. Okay.
Okay, and then I see that Linda Arbogast said that Oberlin is doing a transportation survey right now as well. And Oberlin survey is going to be differentiating between COVID and non-COVID. So, and so I guess, Linda, when are you doing your survey, or when is your survey wrapping up? You can either type or unmute yourself and answer.
Hey, thanks. Our survey went live last weekend and it goes through September 12th.
Okay.
So it's partly to see if people are interested in the electric care program. We made it broader than that because we are looking to expand LCT and biking, walking, other forms of transportation. So we made it broader, and we did also differentiate and ask questions about now during COVID versus when COVID isn't an issue, because I think it really will change people's answers.
All right. Well, then that is another reason for me to make sure that I am very clear on this being a Lorain County survey, so that people, especially in Oberlin, if they receive it, are like, okay, I just got surveyed. Why
right. They'll want to know that this is also important and that it's broader than just Oberlin. Yeah.
Right. Right. Okay. All right.
And Sharon, make sure to do my survey.
Oh, yes. Yes, I will. I will definitely do that since I live in Oberlin. All right. Any other comments that anybody has? Well, I appreciate the feedback that we received. It's very valuable, and that's the reason why I didn't want to do this on my own. That's why we have this TAC meeting, to get all this input, because a lot of you have been doing this for a while and are the experts, and I want to make sure that we, like with Linda, that I know what she's doing, so we can make sure that the information that we're sharing is, people can understand why we're doing it. So that is very important. So I really, really appreciate it. So now, let me get back to my screen. Oops. We are to our presentation. Oops. My presentation is not moving. Yeah, I see. Okay, there we go. So now it's that time in the meeting where we're going to hear from our presenter, Joe. I don't know how to say Joe's last name properly, so I won't butcher it. Oh, that's what's showing. Let me, whoops. Hold on just 1 minute. My screen got messed up. But anyway, we're going to be hearing from Joe from Life Care. And let me allow you, Joe, to share your screen. I'm going to stop sharing mine at the moment.